Yeah.
Why is healthcare freedom so important for a country like ours, and certainly in an unprecedented time like this that we're facing?
Well, I think if you want to see what, government-run healthcare would look like, let's go look and see what's happened here with CDC and the FDA getting in the way of the kind of innovation and the kinds of, free thinking that you'd like to see a country like ours engage in. I'm not saying there aren't good people at the CDC and the FDA doing a lot of hard work. There are. Same thing at the VA and everywhere else. And when we put good people to work, they're going to do good things, but there's going to be hangups. There's going to be bureaucracy getting in the way. Healthcare freedom, personalized care. This is about you being able to go get the care of your choice. And in this environment right now, we've seen so much creativity spring up already in the mere 2 or 3 weeks since this has been a hot issue, in the last month or two since it's been on our radar. In the face of the testing snafu with the CDC in January, you had independent folks in states working up and creating tests from the bottom up, as well as in the private sector, figuring out ways to come up with the right tests that would work. In the end, the CDC, working in conjunction with others, they've come up with a good test, and it's now getting out there. And our great free market system is now pumping that out. And we're getting lots of tests and lots of options that are now flooding into the system. But we want to encourage more of that, not less. We want to encourage freedom and options and the ability for you to go get the care you need. Right now, I want every American to walk out and go get a test. I don't want government individuals or insurance companies, frankly, telling you what that needs to look like. We shouldn't have had to run around last week going, oh my God, or 2 weeks ago, we've got to come up with free tests for everybody. Everybody should be able to go get a test. And maybe the government should back up and subsidize something in an emergency pandemic situation. But ultimately, we want it to be low cost, affordable, and easy for you to go get the care of your choice. I don't want you sitting there wondering if you got it. I want you to be able to go check it. But LabCorp and all of these different diagnostics entities, they're cranking up and they're getting ready to be able to produce all that. Our biggest issue now is that we're all sequestering and keeping ourselves sort of separated. And so, we got to figure out how we can get everybody out and be able to get the care they need.